Welcome back to News 12 this morning. We are so glad you're waking up with us on this Thursday. Can you believe that Halloween is just a couple of days away? A lot of us are getting candy and getting ready for the night, but we're learning more this morning about maybe some of the candies you should avoid and maybe some of the candies you should maybe get. And Dr. Ken Randall from Tennessee River Dental is here with us this morning. How are you?
Doing well, thanks. Thanks so much for having me today.
Absolutely. Thanks so much for being here. You know, we all love candy. Every once in a while, you know, we enjoy having candy, and Halloween is one of those nights. So the kids are going to get all kinds of stuff. We know that. Let's talk a little bit about what some of this candy can do to their teeth.
Absolutely. So it's really interesting when we start looking at cavity risk, because not everybody is created equal, and not all candies are created equal. And so what we find is that the science behind how cavities develop and how cavities work, we can kind of back into candies that might make us more or less susceptible to growing cavities. So for example, candies that tend to be more acidic or that we have in our mouths longer tend to make us more susceptible, whereas candies that we're able to get through faster and all that kind of thing can maybe make us a little bit less susceptible.
So we're talking maybe about, you know, you brought some of these candies. We're talking about maybe caramels.
Yeah.
And gummies, which my son loves, unfortunately. You know, the gummies, or, you know, just the things that really like to stick to your teeth.
Exactly. So yeah, those candies that like to hang out particularly in some of those grooves and nooks and crannies and stick around a while, it helps reduce the pH of our mouth, makes our mouth more acidic, and cavity bacteria love to grow in those acidic environments in there. So we need to be really careful in terms of some of those sticky, chewy kind of candies that like to hang out for a long time.
You know, kids, if they may not be eating a lot of candy, and, you know, when they're going to school, at home, whatever, and the week of Halloween, they're going to be indulging in some candy. You want to make sure and brush their teeth, or they need to brush their teeth, but there's a time frame that you need to do that in once they have the candy, correct?
Absolutely. So it's really interesting. It seems like it would make sense to brush our teeth as soon as we finish eating it to try to get all of that candy out of the way. But what we found is that when things are more acidic, we have more of that debris left in our mouth, we can actually be scrubbing some of that acid onto our teeth. And so what we like to do is wait about a half an hour or so for our saliva to help what we call buffer or raise the pH in our mouth, so we're not being quite as abrasive when we're cleaning up all of the remaining parts of that candy.
So maybe let them enjoy the candy, wait a little bit, and then have them brush their teeth. Now, okay, if you had to recommend some candy, Dr. Randall, what would you recommend to parents out there and those that are giving out Halloween candy? Sure.
So there are some really interesting things out there, maybe not as common to come across, but there's one ingredient that actually can help prevent cavities. It's called xylitol. One thing that I brought today that has a little bit of xylitol in it is actually a gum. And so gums are really interesting from the perspective of they stimulate that saliva flow in there. So they help wash everything out more. And then that xylitol is actually protective against cavities. So if you can find something with xylitol in it, that would be a really, really neat choice to pass out.
Some good advice this morning. Thanks so much for coming on the broadcast today and giving us some information about maybe what candy you might want to purchase for Halloween or what's probably best for the kiddos. We appreciate you coming on. If folks would like some more information about your office, how do they get that, Dr. Randall?
Yeah, so our phone number is 423-877-3848, and we're located up in Hickson near the intersection of 153 and Hickson Pike.
Thank you so much. We appreciate you coming on the broadcast. Always good to see you.
Thanks so much for having me.
If you would like some more information about this interview, please go to our website at WDEF.com.